Good morning, everybody. Well, it is morning here. Greetings wherever you are in your day or week. I am here to go over your week 4 video. We are already here at the beginning of week 4. So we have so far talked about cardiac assessments, lung assessments. This week we are going to be moving into abdominal assessments. Just a quick story for you regarding respiratory assessments. And during my hospital time career, I was in the preoperative, postoperative area or the PACU. And I will never forget anytime I talk about respiratory things or the importance of actually looking at our patients and not always looking at the monitor or a computer screen. Like this story always comes to mind. We had a gentleman who was out recovering. He'd been out for 20 or 30 minutes. He was over on the recovery side. I was actually pre-oping patients. Didn't have anybody, but kept hearing the alarm going off. So went over. It was a newer nurse to PACU. And just was like, hey, like, what's going on? And she goes, his O2 sats, they just keep dropping. Like, I'm not sure what's going on. So we repositioned him a little bit. And next thing, we get a more serious alarm. And I'm like, wow, what's going on? So I'm there like looking at him. She's busy looking at the monitor. I'm like, I need the ambu bag. He's not breathing. He's not breathing. Give me the ambu bag. And we call for anesthesia. We start bagging him, adjust his airway again. He just wasn't quite awake enough yet from anesthesia. And after we got everything, done and stabilized, whatever, I remember her saying to me, how did you know he wasn't breathing? I was looking at the monitor. And I said, you have to look at the patient. So these respiratory assessments are so important. And don't forget that the first part of your assessment always starts with your eyes. What are you seeing? Your ears. What are you hearing? Do you hear audible wheezes? Do you hear air movement at all? Like, don't forget your basics when it comes to this kind of stuff. All right, moving on, changing gears. Let me share my screen with you. All right, so here we are, week 4. You are doing your abdominal assessment. You have 2 assignments to turn in, your abdominal concept lab and the SSE. So the concept lab, just like you've been doing so far, is going to teach you and have you work through a basic abdominal assessment. The abdominal system portion of the assignment, you're going to be looking at the abdominal system of Martin Francis, and you're going to interview and interact with the patient, document your findings, complete your post-exam activities, and you will be taking about 30 to 45 minutes to complete this. Please don't forget to begin at least looking at week 7. On week 7, you do have a a different assignment. It is not one of these labs, so please look at that. There's a separate video there. Just want to put that out there, put that on your radar. If you have any questions, concerns, problems, please don't hesitate to give me an email. I'm happy to work through that with you. You guys are all doing a really great job. I appreciate your timeliness, your professionalism throughout this course. So it's been a pleasure so far for me. I hope you guys are enjoying the course as well, and I am always here to help support. Have a great week.